Mark Scar on KIOW. It's time for House Calls with Hancock County Health System. Your health, our care, a lasting partnership. The topic for August is incontinence. We're talking with Brenda Howke. Brenda is the physical therapist with Hancock County Health System, providing treatment and care at the hospital and wellness center in Britt and at the Garner Rehabilitation Clinic. Brenda, thank you for joining us.
You're welcome.
So the first question is, what exactly is incontinence?
Well, urinary incontinence is the loss of bladder control. It's a common condition in people of all ages. The severity of urine incontinence can range from occasional leaking of urine when you cough or sneeze to having an urge to urinate that's so sudden, strong that you can't get to that toilet in time. You just can't get that key in the door fast enough.
Yeah, are there different types of urinary incontinence?
Yes, there actually are. There are different types, and they can range in, severity levels. The most common is the stress incontinence, and then there's also urge incontinence.
Brenda, can you tell me the difference in these two types of incontinence?
Sure. Stress incontinence is the loss of urine when you exert, what they usually will refer it to as intra-abdominal pressure. And what that is stress on your bladder when you cough or you sneeze, laughing, exercising, or when you go to lift something heavy. And stress incontinence occurs when the sphincter muscles of the bladder weaken. In women, physical changes resulting from pregnancy or childbirth, menopause, can cause stress incontinence. And in men, removal of the prostate gland can also lead to stress incontinence. Urge incontinence, which is a sudden, intense urge to urinate, usually is followed by an involuntary loss of urine, and it's usually larger amounts. So your bladder muscle will contract and may give you a warning of only a few seconds to a minute to get to the toilet in time. And with urge incontinence, you may need to urinate more often or feel like you need to urinate more often, including throughout the night. Urge incontinence may also be caused by urinary tract infections, bladder irritants, bowel problems, Parkinson's disease, Alzheimer's disease, stroke, and injury to the nervous system or nervous system damage associated with multiple sclerosis. If there's no known cause, urge incontinence can also be called overactive bladder.
What is the treatment, Brenda, for these types of incontinence?
Well, typically people will suffer from a combination of urge and stress incontinence, and they can benefit from physical therapy to address both issues before, trying a conservative method first before going to see your doctor or your surgeon. A treatment can consist of both dietary and lifestyle changes, exercise, and biofeedback. The exercises are usually very simple, just to strengthen those muscles in the pelvis, kind of strengthen that whole hammock that supports the bladder and other supportive organs. Outcomes are usually better if it's treated early when your symptoms first begin, but it's never too late to try and initiate a therapy program. Biofeedback is used to calm that nervous system that's irritating the bladder and telling the bladder to contract more often. If urinary incontinence affects your day-to-day activities, you should never hesitate to speak to your healthcare provider because there are more options out there than I think people realize. If listeners would like more health information, I invite them to visit our website at www.trusthchs.com. Our healthy living tools on the website usually include a symptom navigator, health risk assessments, and a drug interactions database.
Brenda, thank you for being with us, and thank you for the information. We appreciate it.
Oh, you're very welcome.
Brenda Howke is the physical therapist for Hancock County Health System, providing treatment and care at the hospital and wellness center in Britt and at the Garner Rehabilitation Clinic. This has been House Calls with Hancock County Health System. Your health, our care, a lasting partnership. On behalf of Brenda Howke, I'm Mark Scar on KIOW.